So first off, do you have any headaches that you suffer from?
No.
Okay, any kind of dizziness?
No.
Have you ever had a head or neck surgery?
No.
No. Okay, perfect. So first I'm going to look at his skull, making sure there are no irregularities. And I'm going to feel around, making sure that there are no bumps, any kind of depressions, which I do not feel any. This also, I'm looking at the contour of it, just making sure that everything is symmetrical, which it in fact is. So now I'm going to be assessing his face, making sure, again, it's symmetrical. I'm going to feel his sinuses. Do you feel any pressure or pain with that?
No.
Okay, perfect. And now I'm going to feel his mandibular joint. Can you open your mouth? Okay, close it. And open it again. And close it. Okay, good deal. So to further check symmetrical, to make sure it's symmetrical, looking at his eyebrows, his nose, his lips, making sure that those are all in line, which they are. I also want to look at his skin, making sure there's no difference in pigmentation noticeably, to document on the file. So now I am also looking for any kind of scarring, any lesions to be noted as well. I'm going to check his temporal pulse, which I feel it's strong and regular. Now I'm going to look at his eyes, assessing his eyes, his eyebrows, the sclera, noting the color of that. I'm going to pull down on his eyelids and his papular. His papular conjunctiva is pink and moist, which is how it should be. Now I'm going to get my otoscope and look for any foreign bodies, any kind of color differences. Okay. I'm also going to assess his pupil reaction. So we'll look right at my nose, ensuring that both pupils react equal to light, which they do. So now I'm going to test his visual field. So if you will put one hand over one eye. Okay, and tell me when you see my fingers.
No.
Okay.
No.
Okay.
No.
Okay, let's do the opposite.
No.
Okay.
No.
Okay.
No.
Good job. Alright, so now I want you to follow my fingers. This is assessing the six cardinal views of gaze, which assesses oculomotor function and the muscles there. So now I'm going to assess for accommodation of his pupils. So if you'll look at my finger and then look back at the cabinet and back at my finger and back at the cabinet. Okay, and his pupils do accommodate that. So now at this point, if I had an ophthalmoscope, I would ask my client to look straight and come in at an angle to assess for red reflex, which looks at blood vessels at the back of the pupil and optic disc and the vascularity there. So now I'm going to move on to ears. I'm going to note the placement and the symmetry, ensuring that they are equal. Now I'll ask my client, do you have any discharge from your ears?
No.
No. Okay, do you have any hearing loss that you know of?
No.
Okay, do you have any environmental concerns, such as your workplace, at home, that may damage your hearing or impair it?
No.
Okay. Alright, do you notice any tinnitus, which is ringing in your ears?
No.
No, okay. Alright, so now I'm going to conduct what we call a whisper test. So I'm going to ask my client to cover one ear with one hand, and I'm going to whisper and have you repeat back what I say.
Apple.
Okay, now let's switch.
Baseball.
Okay, so he did pass the whisper test. Now I'm going to do what we call a pinna test. So I'm going to tug on the outer part of his ear to ensure that there's no pain associated with that, which could mean that there was inflammation and could be worsened by using an otoscope. So, do you feel any pain?
No.
Okay, so now I'm going to look at the internal structures of his ear. Okay, specifically at the middle and inner ear and the tympanic membrane. So now I'm going to do the same thing on the next side. Do you feel any pain?
No.
Okay, so now I'm going to look again. Okay, again noting the middle and inner ear, as well as the tympanic membrane. So, I'm also looking at the bony prominences in the malleus of his ear, as well, and assessing for redness, which would indicate some infection and any discolored drainage. So at this point, to further assess his hearing, if I did tuning fork, I would ring the tuning fork, place it on the middle of his forehead, and ask him if he heard it more so in one ear or another, which assesses for lateralization of one ear or another. Another hearing test that we do is called a Rins test, which you use a tuning fork, place it back here, ring it, place it back here, and tell the client to tell me whenever it stops, and then put it out by the ear and hopefully they would hear that as well. So we are just demonstrating that verbally because I do not have a tuning fork. Now I'm going to assess his nose. First looking at symmetry, looking at the ilia, any kind of obvious deformities or lesions. Do you have any issues with your nose that you want to tell me about?
No.
Any kind of abnormal discharge?
No.
Okay. So I want to ask my client to flex his neck up. Okay. And then I'm going to place my otoscope in both of his nostrils, looking at septal deviation, as well as just looking at the mucosa, any kind of polyps or again abnormal discharge that may occur there, which it looks pink, moist, intact, which is exactly what we want. So now I'm going to look at his mouth, first inspecting it externally. So looking for any kind of dryness, any cracked lips, anything like that, which it doesn't seem that he has. I'm going to ask him to open his mouth, stick out his tongue. Okay, and I'm going to look back, say ah. Okay, and I'm just looking at his tonsils, making sure his uvula is midline, which it is. Can you lift up your tongue? Okay. Looking at dentition, as well as the ducts under his tongue, the saliva ducts, making sure those are pink, moist, intact. I'm also looking at the back of his throat, making sure it's pink, no signs of redness or, any kind of inflammation or pus, which there is not. I'm also looking at his hard and soft palates, and those are intact as well. So normally at this point, if I had gloves on, I would ask him to open his mouth, and I would feel the inside of his cheeks to make sure that there are no masses of any kind. So I'm just going to verbalize that. Now I'm going to move on to his neck. So first I'm looking at the alignment of his throat, alignment of the trachea, which it is midline. I'm going to ask him to turn to one side or another. Okay, and swallow. Okay, now the other side, and swallow. Okay, this allows me to feel his thyroid, checking for any kind of enlargement, any nodules that would need further examination, any masses or lesions. So now, can you move your neck all around in a circle? Okay, this assesses for appropriate range of motion. Now I'm going to have you to turn your face toward my hand. Okay? And again. Okay. This assesses the muscles in his neck to ensure that they are intact, which they are. So now I'm going to assess his lymph nodes. So I'm going to start out right by his ear. Okay. And behind them. I'm going to the submandibular and the submental and the anterior cervical and the posterior cervical. Okay, and then the supraclavicular and the infraclavicular and the occipital. So normal lymph node sizes are at least pea size or smaller. They are mobile, they're able to be moved around, which all of his are. So that shows signs of, a healthy person with no infections noted or present. So now I'm going to also, upon my inspection, note if there's any kind of notable or obvious goiter, which I do not see one, and during my thyroid check I would feel for any kind of goiter, which he does not have. So, do you have any questions for me?
No.
Okay. Alright, well that concludes the head, ears, eyes, nose, and throat assessment.